Hey guys, Dr. Asaad Samra here, board certified plastic surgeon. Today's surgery day. We're at the surgery center and we've got a couple of cases to show you. First up is a breast reduction. We have a young lady who has what's called hypermastia or macromastia, so she has large breasts and she would like to make them smaller. So we're going to be doing what's called breast reduction. We're going to show you the markings of our patient before we get started so you get a sense of what we're going to do.
All right, guys, so here we are pre-op with our patient, a lovely 32-year-old who has macromastia that's going to have her breast reduction today. We're going to show you the marks that we've done before surgery before we go back into the operating room. So as we take a look, you'll see that some of the initial marks that I've made have been just to mark the anatomy. So I've marked her sternal notch as well as the midpoint of her clavicle on either side and how that translates to the middle of her breast as it comes down toward her nipple and areola on either side. Then we've marked a point known as Patangi's point that is really the reflection of the fold of the breast from underneath as it touches and or is reflected on the front of the breast. The intention is where her nipple is now in her breast, we hope to move it up to that point. This is referred to as a wise pattern breast reduction, and so we have a W-shaped incision as it comes across her breast like such, and then the tips of those W meet along the bottom of her breast along the fold. Our intention is to preserve this central part of her breast tissue with the top of it being where her nipple and areola is. We're going to make her areola a bit smaller with an incision coming within the areola. And then once we've isolated that tissue, otherwise known as a pedicle, we're going to get rid of tissue that's out here along the top of the breast and also on the inner aspect of the breast, just about almost like a horseshoe-shaped incision. That W will then come together and then come across the bottom, giving her that lifted effect. We'll need to make another incision to bring her nipple and areola back out, and certainly we're going to do the same thing on the other side. But these are the markings that we do before surgery, and then when we go back, we reinforce these markings, prep the patient, and then we get going. And we'll show you that in the operating room.